Welcome to Nursing School Explained and this video in the Care Plan Help series where I go over liver function tests. Now, first of all, LFTs or liver function tests consist of several different tests. They're always going to be separate, but many times they can kind of be grouped into LFTs. There are occasional considerations where we have to look at them individually, but for the most part, since they're all pertaining to the liver, our actions, assessments, and interventions were probably going to be the same. And the liver function test that we usually look at is ALT, AST, alk phos, and bilirubin. More or less, it's not really a liver function, but it's kind of a byproduct that has to do with liver function as well. So whenever we think about the liver, we have to think about jaundice. So we want to assess the patient for jaundice, skin or eye changes. And then because the liver has so much to do with the oncotic pressure and the plasma proteins, we want to assess the patient for edema, ascites, as well as we want to take a look at their abdomen to see is the liver enlarged, is it tender, and also check their bowel sounds, because if there is ascites presence, maybe that affects the bowel sounds. We also want to assess any history or current taking of any hepatotoxic drugs, because certainly they can affect the patient's liver function, and that might be something as simple as Tylenol or acetaminophen. Keep in mind that acetaminophen is also in many of the narcotics that we give the patient. So for example, in Norco might contain also some acetaminophen. So make sure that you know the ingredients so that you don't give the patient accidentally too much of the Tylenol and cause them some liver problems. Then we want to check any history of liver, gallbladder, or pancreatic disorders. And in this case, that's so important because these three organs lie really close to each other. And so if one is affected, maybe there's an obstruction of some sort, and it certainly can cause the backup of the bile into the liver. And then we have the problem that is evident in the liver function. We also want to check for any current or present or past history of hepatitis, any kind. And then in case the patient is pregnant, we want to make sure that we assess them for HELLP syndrome and preeclampsia. Now, in the example that we've been using here was this 45-year-old female who has had a gallbladder removal, cholecystectomy, and her past medical history includes diabetes, hyperlipidemia, and she's a smoker. So in this case, we want to certainly assess for all these things because she doesn't really have a disorder like a chronic disorder, but she did have her gallbladder removed. And so we have to make sure and be aware that there could be something going on with any of these three organs. Certainly we want to assess her abdomen and her bowels, check for any hepatotoxic drugs, maybe also any kind of insulin coverage that she's on or anything else that pertains there. And then any past history of hepatitis. And if she were pregnant, which she may or may not know, then we'd have to look into that as well. In terms of interventions, we don't really have a whole lot of interventions to do here because we're mostly assessing the patient. And certainly if we have any of these findings that are concerning, we would notify the provider so that they then can intervene and give us orders on how to address the patient's elevated liver function tests. Thanks so much for watching this video in the Care Plan Help series. Also check out all the other videos about the different lab results and make sure that you apply the findings and the assessments that we discussed here to your particular patient in clinical so that you can show off all that knowledge to your clinical instructor on your own care plan. Thanks for watching. See you soon.